So there are a number of different treatments for hemorrhoid symptoms, and it depends on what kind of symptoms are bothering that particular patient. If the symptom is just bleeding, that's commonly from internal hemorrhoids, not external hemorrhoids. And internal hemorrhoids, because they're covered with the lining of the bowel, we can do things to them without a lot of pain and discomfort and downtime and surgery. We can treat them in the office with things like a rubber band ligation or an injection of the hemorrhoid that will get rid of the hemorrhoid tissue or stop the bleeding without surgery. And as I said, with just a simple office procedure that doesn't require anesthesia and doesn't typically require time off from work. So we have some simple things that we can do. If the problem is really pain and swelling on the outside, really the only thing we have for outer hemorrhoids is to do some sort of surgical procedure. And the problem with surgery is we've been looking for a painless surgical procedure for hemorrhoids for millennia, and there just isn't one. Hemorrhoid surgery is pretty miserable. So the hemorrhoids have to be bothering you a lot, really interfering with your life to want to have to undergo hemorrhoid surgery. And that's what I tell the patients. You know, if this is really interrupting your lifestyle or preventing you from going to work, not just once, but on a more regular basis, then that's when we start considering something like surgery. There is a more novel surgical procedure that's designed specifically for hemorrhoids that come out of the bottom, as opposed to hemorrhoids that are just on the outside and swollen and hurting. It's called a stapled hemorrhoidopexy. It is a surgical procedure, but it's a lesser procedure than the standard surgery. Tend to be a shorter recuperation period, but that's a specific procedure for a specific problem. And there are additional other more novel ways to treat hemorrhoids that are available at certain centers that are sort of variations on the theme of the hemorrhoidopexy, and that use some infrared technology, sometimes some Doppler ultrasound technology to try and treat the hemorrhoids. So there are a number of different ways to treat hemorrhoids from a procedure point of view, and we try and tailor that to what kind of trouble the hemorrhoids are giving that individual person and what their expectations are. But the main thing that I tell everybody when I'm going to treat their hemorrhoids is none of these procedures remove all the hemorrhoid tissue, because the tissue goes all the way around the bottom. And if we try and remove it all, then there's no bottom left, and that's way worse. So all procedures leave some hemorrhoid tissue. No matter what procedure you've had, the hemorrhoids can come back.